Good afternoon to everybody. First of all, I'd like to thank the organizers for inviting us. Although, as Professor Black said, Israel is not part of the European community, but nevertheless, we see ourselves as European, and we would like to share with you our practice in Israel of Fit for Work. This presentation is going to be mutual between me and Dr. Nordheim. And this mutual presentation represents actually the interactive work between the policymakers, which are represented by Dr. Nordheim, which is from the Ministry of Welfare and Social Affairs, and between the society, the physicians, and the patients, which are represented by me. Okay, so if we start, this interactive and mutual work between society and policymakers started actually from beginning, from preparing the Israeli report. And many authorities were actively involved in preparing this report. And as you can see, during all stages of writing, many patients and people from the academia, from the Ministry of Labor, from the Ministry of Health, Welfare, from thick funds, were actually involved, and they all met with Stephen when he was in Israel in trying to prepare this report, and in order that the report will be accurate and right and will represent what happens in Israel. This is further enhanced by the support of the Ministry of Welfare and Social Services, Mr. Isaac Herzog, whom you can see what he thinks about the report. He thinks that it's required to conduct a coordinated, strategic, interministerial thinking, how to get people back to the labor market. And when the Minister of Welfare and Social Services acts like this and brings his idea like this is very important, and this gives an emphasis of how we try to implement the Fit for Work report in Israel. And now, just a couple of main findings about the Israeli report. The report done by the Work Foundation found that about 700,000 patients, Israeli patients, they suffer from chronic musculoskeletal disorders, and this is about 10% of the Israeli population, which counts about 7 million people. And what's more important is that the annual cost of these chronic musculoskeletal disorders is estimated at $4 to $7 billion US. We still speak in dollars and not in euros, so you can translate it in euros. And like in other countries, MSDs are the main cause of work absences and permanent job loss. And after getting this report, there was the launch of the Health Economy Forum. All people from decision-making policies, like from the government, from the employees, from the Social Security in Israel, and also rheumatologists and patients from rheumatic associations, they took part, and everybody gave his part in this discussion. And what are the outcomes of this forum that happens? The outcome, first of all, in the media, over 50 publications were done in all media in 4 languages: Hebrew, English, Russian, and Arabic, and they appeared in all kinds of media following this forum. Another outcome is the awareness. So this forum brought up to the public the agenda of disabling diseases and their impact on work and society, and also brought up the problem of early diagnosis and early treatment of rheumatic diseases. But an important thing in the outcome is the commitment, and Dr. Nordheim is soon going to talk about the commitment of the policy-making people. The creating of a wide coalition of participants from a variety of professions that took obligations, each one in his interest area. This is very important. And also, for the first time, because there were also sick people and people who suffer from all these MSD, so for the first time, patients could hear from the policy-making people the definite obligations from their people that they chose from the government people. And now I'll handle it to Dr. Nordheim in order to continue what are the outcomes from the policymakers.
Okay. Good afternoon. In the global market economy and in this era of increasing globalization, the health condition of Israeli employees gives cause for great concern to the Israeli government and mobilized it to examine and browse the implications to the phenomena. The Minister of Welfare and Social Services, Knesset member Yitzhak Herzog, was introduced a year ago to the Fit for Work research, and he expressed his support in promoting the report and spreaded the collaboration of his ministry right from the beginning. Upon publication, the report generated much interest in the ministries and the ministries undertook to examine the issue and have already begun implementing its recommendations. The Ministry of Welfare, which I represent, the Ministry of Welfare and Social Services has been caring for years for persons suffering from musculoskeletal disorders. Rehabilitation centers are spread throughout the country, aimed at training, handling employment restrictions, psychosocial interventions, and work placement. Persons cared for at these centers suffer from many employment restrictions, such as psychosocial restriction, low education, lack of professional training, hospitalization in a shelter or protected factories, or for very low level functioning people, and other restrictions. The report sheds new light on the need to care for a broader population that holds rehabilitative potential, as well as increase the means of prevention. The National Insurance Institute of Israel allocated 1.2 million, also it's not 90 million, but it's a start, shekels, to fund a new program concerning employee health focused on the prevention of musculoskeletal damages, ergonomics, and similar issues. The program includes intervention at 30 workplaces in which the following issues will be promoted. For example, maintaining a healthy lifestyle, healthy nutrition, physical exercises, improving the workers' well-being and alertness, and, as already mentioned, reducing the risk of intensifying musculoskeletal disorders. Also in this program, the establishment of a course for trustees of occupational health and ergonomics targeted at representatives of the workplaces who would later be responsible for further development and maintenance of the healthiness of the workplace. The Ministry of Health, every year a public committee convenes in Israel to determine which new drugs would be included in the national drug basket reimbursed by the state. The Ministry of Health is currently formulating a bill regulating the acts of this public committee. As part of the debate, the possibility of adding a work productivity parameter as a criterion for the inclusion of a new drug in the health basket is being favorably considered. In addition, the Ministry of Health is developing a program based on the Fit for Work report for further elaboration of the workers' health framework. The Fit for Work report is used by the Ministry to strengthen the basis for promoting additional budgets for this extension. Ministry of Industry, Trade and Labor. One recommendation set forth by the Fit for Work report was to gather more data and measure the extent of the phenomenon in Israel. The Ministry of Industry, Trade and Labor is currently investing millions of shekels in the establishment of a national registry for occupational disorders stemming from or aggravated by work. The objective of the registry is to monitor and quantify workforce disorders, among which are the musculoskeletal disorders whose broad extent has been brought to light. It is intended that the registries shall work continuously and over time, which translates into constant and ongoing funding for its operation. Once data would be gathered, it will be possible to effectively focus required action on prevention based on this evidence. The Prime Minister's office has specific department. The Authority for the Promotion of Women at the Prime Minister's office also considers it highly important to investigate and contain the phenomena. The authority promotes the employment of women who are the main sufferers of rheumatic diseases. Among its roles, the authority encourages the adjustment of workplaces to the population of Israeli women and their encouragement to maximize their integration in the Israeli economy. These diseases reduce women's ability to compete in the free job market, notwithstanding additional challenges Israeli women face. The authority is currently working to integrate some of the Fit for Work recommendations in its 2011 work plan. Following the publication of the report, the Ministry of Industry, Trade and Labor, the National Insurance Institute of Israel, the Ministry of Health, and the Ministry of Welfare and Social Services have determined to establish an interministerial committee to explore appropriate steps for the treatment and prevention of musculoskeletal disorders, including means for early diagnosis and increased work motivation. The process has merely begun and will take time for overall implementation. However, the drive and willing to collaborate, the commitment to promote the issue and prevent musculoskeletal disorders in Israel are already set in motion.
As you can see, we brought people from the policy making in order so they will tell you exactly what the government is going to implement, and now they cannot go back, and that was the reason why we brought Dr. Nordheim here. Now, these are the outcomes from the policy making people. Now the outcome of the physician. First of all, a letter by all the participants in the forum was signed, and it was addressed to the Minister of Health for adding more positions in rheumatology and in occupational medicine. All the people that took part in the forum signed this letter. Another thing that happens, as you heard from this film that you saw, is a symposium that is going to be organized on December, and it's going to deal with the interaction between rheumatologists and occupational medicine physicians in order to know how to treat and how to deal with all the sick leaves and sick notes and whatever is going with these patients. And we also updated all the clinicians and physicians in Israel by a newsletter about the data that were presented in the forum, and also about the grant offered by the National Institute and National Insurance Institute. Actually, 1.2 million shekels. It's not so high. This is about 300,000 euros. But anyhow, it's much more than was before. Another sick fund, the smaller sick fund that insures about 800,000 people, also is working on guidelines for primary care physician in order to detect early all kinds of MSDs. Now, what are the future activities? And I'm going to finish soon, I know, 2 minutes. First of all, we want to identify workplaces for starting an interventional preventing project, and then to create a country-wide information campaign to explain the importance of early intervention and on maintaining good health of the workers. Thank you very much for your patience and attendance.